I treat mostly adult patients with central nervous system tumors, particularly centered in the brain, base of skull, spine, as well as head and neck cancers, and specialize in cranial and extracranial stereotactic body radiotherapy. Particularly for the area that I treat, it is essential to have a multidisciplinary approach, and so being under one umbrella facilitates that discussion and then prompts efficiency in getting the patient through the system. When I sit with the patient on that initial consultation, majority of time is spent describing the various techniques we have. Most patients come in, they're very well informed, there is a lot of information, and so I try to guide them into, okay, this is your tumor, this is where your normal tissue is, and this type of treatment may not be appropriate for you, but this other one is. And so the luxury, of course, that I have is that I can actually tell them we have this here. You don't have to go elsewhere to find what's right for you. I discuss with patients, one of their biggest fears, particularly when they're coming an hour, 2 hours, 3 hours away, some of the conveniences that they'll have, some of that extra stress that they won't have to worry about. All patients under treatment, will come in and get their parking valeted, so that is one of the biggest stress relievers. We have very accommodating hours. We treat from very early in the morning to late in the evening, and so that facilitates for a lot of patients, allowing family and friends to bring them in for treatment. It is a very big place, but there are people along the way that will guide you. I think one of the greatest things that we have implemented is that we do have a patient education course. Anyone starting radiation once a week can sit in this course, both patients and families, and it is an introduction to the department. It can happen before you get started with treatment, it can happen in your first week of treatment, and it's a description of this is what we have available, this is what we can do. Our social work department is incredible, is the best way to describe it. They help really to alleviate a lot of these other stresses, from finding logistics, including lodging closer to the Penn when they are 3 hours away, to facilitating meals that can be taken home, to facilitating prescriptions, all those little things that add to a patient's stress and a family's stress can be alleviated pretty much under one roof. Having nutrition available to us, they're losing weight during treatment, there is a stress involved with that. The nutritionist can see you, help guide you. We have a great ancillary staff. We have Penn home infusions that can go to the house, Penn nursing services. All of those are integrated into our department as well, and we attempt to use those facilities to help patients get through treatment. I am Dr. Michelle Alonso-Basanta, Helene Bloom, Assistant Professor, Department of Radiation Oncology, Penn Medicine.